So as with anything, you've got a couple considerations. With surgical applications, you've got the client's financial picture that's going to have a bearing on whether or not you get compliance for a suggested treatment. You've got the well-being of the animal. Again, if they're geriatric or older, the anesthetics may or may not be a risky proposition. So it's a consideration, certainly. And then you're going to have procedures where your outcomes, the prognosis may be a low percentage prognosis, but it's the best option that we've got because we've got no other mechanism at our disposal to go after that indication. From a pharmacological standpoint, you've got tolerance issues. A great example of that is in the feline application. Your ability to mitigate mobility and pain issues very, very limited with pharmacological solutions. You're not going to put a cat on a water treadmill. You're not going to have them jump through hoops. So your rehabilitative opportunities there with feline are almost non-existent. So what do? Well, you live with it. The animal lives with it. You put them and make them as comfortable as possible because that's the only option you've got. And the same can be said for other species, canine and so forth. So you are sometimes limited in what you can accomplish with pharmacological solutions, in many cases relating to the tolerance level of the animal. And the other thing to consider with NSAIDs, non-steroidal anti-inflammatories, you also tend to get a tolerance level built up. So twofold, you've got the animal's ability to handle the medication, and then you have the animal building a tolerance to the medication where it requires more and more and more dosages to get that same desired effect. Simply put, it's the best of a bad option. It's the lesser of two evils, kind of a thing. You don't treat, or you overload with NSAIDs. There isn't much else out there that you can do. Fast forward to having the laser device at your disposal. Now you've got a non-invasive application or non-invasive platform with which to go after these indications. And it's substantially better for the health of the animal on many, many levels. And you're allowing the body to rapidly heal itself. And there isn't a tolerance threshold built up with the animal when it comes to laser treatment. They don't require more and more and more dosages. It just simply doesn't work that way.